Do you know how your patients feel about your medical practice? Understanding your patient's satisfaction is crucial to the success of your medical practice. One way to gather feedback is with patient satisfaction surveys. With access to this information, you can create a plan to make changes to your practice and meet your patients' needs. 81% of consumers say they are unsatisfied with their healthcare experience. This is why it is important to give your patients a satisfaction survey. Today, we will be talking about 5 patient satisfaction survey questions to help you get started. I'm Raid, here with Jotform. Let's get into it. Before we get into the questions, it's important to understand that you need quantifiable results from this survey. It's a good idea to ask your patients to rate their satisfaction on a scale of 1 to 5, 1 being poor and 5 being excellent. This will give you a consistent way to compare and analyze your data. The questions in your survey should be easy to understand and written in a way that will give you feedback that can truly help you improve your patient's care. Now, let's take a look at these 5 critical patient satisfaction survey questions that you should include in your next survey. First up, we have, how easy was it for you to schedule an appointment? In order for healthcare to be effective, it has to be accessible. The first steps to providing satisfactory care is giving your patients an easy way to schedule appointments. Your patients are busy and oftentimes sick or injured when they contact you. This means that if they get frustrated trying to schedule an appointment with you, they will likely quit and go somewhere else. While phoning your faculty is an option, a lot of patients would rather book an appointment online and outside of traditional business hours. In fact, about 77% of patients think that it is important to be able to book, cancel, or change appointments online. Make sure that patients have a way to schedule appointments on your website. This process should be as easy as possible. In your patient satisfaction survey, ask about the ease of booking appointments online and how you can improve the process. If you are getting a lot of complaints, then it's time to reevaluate your scheduling process. The next question is, how would you rate your wait to see a provider? No one likes being kept waiting, especially patients in a medical facility. Having to sit in the waiting room far too long will negatively impact your patient satisfaction scores. Of course, some wait time is inevitable, but you should still ask your patients about their experience and how long they waited. Your patients need to know that you value their time. For instance, if your patients have to consistently wait more than 20 minutes past the time they are scheduled for appointments, then it's time to reevaluate your scheduling process. Consider scheduling fewer appointments with more time allotted for each patient. You can also look for inefficiencies to keep appointments moving forward as scheduled. Our third question is, were you satisfied with your interactions with the doctor and office staff? Quality customer service is vital when it comes to patient satisfaction. Ask your patients if they were treated kindly and with respect by the doctors, nurses, and office staff. This will provide valuable insight on how your staff is handling customer service. And in the survey, leave space for them to explain their rating behind this particular question. Patients may want to praise a specific employee for their actions or discuss a difficult encounter that they had with a member of your staff. Next, how was the overall care you received? This question encompasses the entire visit. Patients can reflect on everything from making an appointment and waiting to be seen to the interactions they had with the staff. They can give you an overall view of the quality of care that you provide. And if patients are regularly giving you low ratings for your overall care, then you'll have to figure out where those problems are and how you can resolve them. Our final question is, how likely would you be to recommend our medical practice to your friends and family? The best way for you to grow your patient base is to give such great care that your patients will want to refer friends and family to you. On the flip side, if patients are not satisfied with their overall experience, then they will not refer you. They might even tell their friends and family not to go to your practice. So if most of your survey respondents say that they would refer a family member or friend to you, then you are most likely providing them with exceptional care. Now that you have a good batch of patient satisfaction survey questions, it's time to figure out how to administer the survey itself. You can, of course, distribute paper copies in the office or through the mail, but this isn't very efficient. It would be much better for you and your patients to administer an electronic survey. This allows patients to complete the survey on a mobile device, on their laptop, desktop, or on the computers in the waiting rooms. Using electronic surveys, you can gather valuable feedback as well as patient information for treatment purposes. Okay, let's review these questions one more time. The first question is, how easy was it for you to schedule an appointment? Then, how would you rate your wait to see a provider? Were you satisfied with your interactions with the doctor and office staff? How was the overall care you received? And finally, how likely would you be to recommend our medical practice to your friends and family? When it comes to administering your survey, it's best to do it electronically. That way your patients can fill it out anytime and anywhere. Once you start to receive survey responses, make sure that you take your patient's criticism to heart. This can help you greatly improve your medical practice. Thank you so much for watching. I hope you enjoyed today's video. I'm Raid, here with Jotform. Have a good one.